Hello, I'm Dr. Greg Mattingly, and I'm here with Dr. Russell Barkley to discuss how challenging the early morning routine can be for children with ADHD and for their families. Dr. Barkley, let's start with an overview of ADHD and then tie that in with why early morning functioning impairments, or functioning from the time the child awakens until they arrive at school, is such a challenge for children with ADHD as well as their families.
Well, thank you, Dr. Mattingly. We're all familiar with the overarching core symptoms of ADHD, the inattentiveness, the hyperactivity, and the impulsiveness. But it's important to note that ADHD is among the most common child psychiatric conditions, with behavioral symptoms that fluctuate throughout the day. Current therapies mostly focus on adequately controlling symptoms while kids are in school, and more recently, extending the therapeutic effects after they come home from school. Now, most caregivers administer ADHD medication to their kids upon awakening, but we're finding that this dose timing may not provide adequate control during the early morning routine, because currently available stimulants can have an onset of action for up to 2 hours after administration, leaving the child unmedicated during what is typically the chaotic period of the day.
Okay, let's talk about early morning functioning in more detail. What hours during the morning are we talking about? And how is ADHD affecting kids' ability to get their act together, as it were, during this time?
Well, simply put, the early morning period is that time frame between when a child or adolescent awakens until they arrive at school. During this period, a child with ADHD has a multitude of tasks that need to be completed, as does the parent or caregiver. The child's functioning impairments during this critical period increases the demand on the caregivers and can lead to conflict among the family members. You know, what amazes me, Dr. Mattingly, is how little attention has been paid in the research literature to this. There's only a few studies, Dr. Salih's surveys and others, that have even focused on this. And yet you and I know from discussing this with patients that when these families come to us, this is a very disruptive time of day. And they often wind up starting the day on the wrong foot, distressed, chaotic, angry, often feeling guilty as their children head out the door for how bad the morning has gone.
So how do our current treatment options, how well are they working for that early morning period?
Well, they're not really working at all. And so what you have are families who are struggling to come up with some coping strategy that they can apply to try to patch something together. And it really is a Band-Aid. I mean, you know, some parents are getting their children up several hours earlier than the child should be awakened in order to administer the medication. So now you've disrupted their sleep, which is already disrupted in ADHD children. More than 40% of these children have sleeping difficulties, early waking, restless during sleep, and inefficient sleep. And if you're waking them too early, you're cutting into that critical sleep period, which can only feed forward into more inattentiveness in that school day. And yet families know this. And so on the one hand, they need to get the medication in early so that the child can get off to school properly and in a timely way. But on the other hand, they know that they're taking from the other side, from the sleeping side that is so important. And yet this is all they have. There is no choice.
So how do we do a better job of kind of looking at medications, their place in that early morning time frame?
Well, I think it's absolutely crucial. In a research survey conducted by Dr. Randy Salih just last year, parents were asked to rate the severity of early morning functioning in their children with ADHD. Parents and caregivers reported that early morning ADHD symptoms were more severe than at many other times throughout the day. In fact, 76% of caregivers rated their child's early morning ADHD symptoms and impairment of early morning functioning as moderate to severe. Now, based on separate data by Dr. Salih in one report and Dr. Carol Whalen and colleagues in another, caregivers report that children and adolescents with ADHD have difficulties and impairments immediately upon awakening and manifest throughout the early morning routine. During this early morning period, children struggling with early morning functioning have difficulty adhering to a complex sequence of behaviors, such as waking and getting out of bed, getting dressed, brushing teeth and self-hygiene, sitting down for breakfast and eating, getting ready for school or other activities, and getting ready to leave the household.
Dr. Barkley, this seems to speak to time management skills as well.
Absolutely. Completing these complex behaviors requires time management and working memory skills that are frequently impaired by ADHD symptoms. Research has demonstrated that children with ADHD have an impaired ability to gauge time and have a developmental delay in their gross sense of time. These deficits frequently manifest into disorganized patterns of memory recall and planning as compared to children without an ADHD diagnosis.
What are the consequences for youth with ADHD?
Well, we've talked about the impaired organization and the self-care and preparation for the school day that is inherent in early morning functioning impairments in kids with ADHD. But this can also affect other domains in their lives. Children may be at risk of being late for school, forgetting school materials such as books, homework, and other things, unintentional injuries or accidents. These issues may lead to the development of academic and social difficulties, disability, or worse.
So talk to us a little bit about what caregivers have seen, what they tend to look for with children, and what options they're trying to find for their children.
Well, as you know from Dr. Salih's survey, 79% of these caregivers had previously discussed this problem with early morning routines and functioning with their doctor. Nearly half, 48.3% of caregivers, indicated that they had woken up early in order to administer their child's ADHD medication. Hence, the disruption starts right at the get-go. I mean, it's unimaginable to a family who doesn't have an ADHD child how chaotic and disruptive these early mornings can be, and the spillover it can have on the rest of the day. Because of the child's ADHD symptoms during the early morning, caregivers of children with ADHD report they often feel overwhelmed and exhausted, raise their voice more than they want, feel constantly stressed, feel inadequate as parents, and punish more and praise less. And these feelings may feed into how parents feel about themselves as parents. Mothers of children with ADHD are more likely to report a lower overall quality of life, feeling ineffective as parents, viewing their child as limiting their family's activities during the morning period in comparison to mothers with children without an ADHD diagnosis. In summary, children's ADHD symptoms can reduce parenting effectiveness.
Thank you, Dr. Barkley.
My pleasure. Thank you.
In this chapter, we've discussed the difficulties of managing the early morning routine for caregivers and for children with ADHD. Be sure to watch the other videos in this program. Dr. Ann Childress discusses the Before School Functioning Questionnaire, or BSFQ, an assessment tool for measuring the severity and frequency of before school functioning in children with ADHD. Dr. Michelle Novotny provides tips and tools for strengthening working memory and organizational skills in children with ADHD.